For a woman to conceive naturally, the ovaries, fallopian tubes, and the uterus should be normal and healthy. A healthy uterus can carry the embryo till term, but we come across many females who are unable to conceive naturally due to thin endometrium. Either they are not able to conceive or they face repeated abortions due to it. The uterus is divided into three layers. The outermost layer is the serosal layer, which is made of epithelial cells. The middle one is the myometrial layer, which is made of smooth muscle cells. The innermost layer of the uterus, also known as the endometrium, is the most important layer, which plays a crucial role in fertility. It is because the embryo implants here and it grows till term here only. Many ladies suffer from thin endometrium, due to which they are unable to conceive naturally, or if they conceive, they face repeated abortions. The endometrial thickness may vary from cycle to cycle. This is this layer which is shed during menstrual cycles. The thickness may vary according to the hormonal status of the female also. Now, coming to the causes of thin endometrium, the first cause is insufficient estrogen hormone production, which may be natural or may be age related. In females with history of tuberculosis or repeated genital infections, the endometrium is adversely affected and it remains thin and hence prevents implantation. In females with a history of dilatation and curettage, due to overcurettage, this endometrium is damaged and cannot be revived even with the medicines. In cases where female is overweight, that is her BMI is more than 30, or when the female is underweight, her BMI is less than 18, thin endometrium can be encountered. In patients where there is decreased endometrial blood flow, which may be due to advanced age or due to any other cause. Now, how to diagnose a thin endometrium? First of all, history is very important. The patient often gives the history of scanty menses, that is, she has blood flow just for 1 or 2 days or only spotting. She also gives history of previous infections, which may be tubercular or recurrent genital infections. Any history of dilatation and curettage is also seen in such patients. Ultrasonography plays a crucial role as the endometrial thickness can be evaluated through it, and it is a non-invasive procedure. The endometrial thickness is less, that is less than 5 or 6 mm in the late follicular or luteal phase, is known as thin endometrium. In some cases, medicines can be given for blood thinning, for improving the blood flow of endometrium and increasing the thickness. But if there is no response of the medicines, then a minor procedure known as hysteroscopy is performed. In this procedure, under general anesthesia, a small endoscope is introduced through the cervical canal to see the endometrial cavity. If there are any adhesions or any other problem, we can encounter and we can correct it immediately. Endometrial scratching is done or adhesiolysis is done to improve the uterine cavity, and later on the endometrium and the blood flow is improved with the help of medicines. Hence, we can always correct a case with thin endometrium if it is diagnosed properly and the reason for it is diagnosed properly.